shortness of breath during doing some work or climbing stairs. That's the main problem I have had. I started in 2022. At that time, when I do heavy work like running for some, that only gradually over the years the problem increases.
After surgery, any pain, any
No, side effect.
Sir, doctor, you said 50-50 actually. 50 success. What is the became successful? What is main factor became successful?
The main factor is our technical expertise of to manage this patient, because we have seen so many varieties of cases over the 45 years. Many challenging cases I have done. So I knew that looking after, even though from outside it looks inoperable, sometimes the main thing is I have to make a cut and take out the valve and put in a valve. So from our experience, we know when we see the aorta, feel with our finger, I know which patient I can cut and the stitch will hold. So with that only I proceeded with the operation. I remember way back in the 80s, 81, when I was studying in for MCH, we opened like a hand patient like that. We couldn't do anything. We just closed and felt that it is nothing can be done, and he didn't live that long. So I have seen it before. Some cases, and also sometimes we operated, it may not be that successful. So it is a matter of experience only, all this. The more you see, the more you know. It is something called the sixth sense, I would say. Because another person may feel that nothing can be done, but an experienced person definitely will be able to tackle a complex case. So that is why he was referred here. They know that we are doing all these cases here in SIMS. Yeah.
This one is local or imported?
It is made in India only. Chitra valve, TTK Chitra valve.
And what is the life of the valve?
That valve will last for life. It will outlive the patient. Only problem is you have to take breath-thinning tablet throughout life. That is the disadvantage of a mechanical valve. Now, other alternative, if the surgery is not possible, you can put a tissue valve by TAVR, we call. Without operation, we do valves now. But in a young patient, if you put a TAVR, it will not last more than 6 or 7 years, or sometimes maximum 8 years. That also was not possible, because if it is truly inoperable, only alternative is put a TAVR. So that is a big disadvantage for him. And it could not be done technically because of the rocky calcium sitting inside there.
No, you have normal life after.
Yeah, he is almost now, he is going home.
Physical activity.
Yes, normally in our another once the bone healing will take about 6 weeks. So after 6 weeks he will be able to do all normal. Now itself he is normal. He is walking around. He can climb stairs. The tolerance to physical activity will become normal. In 2 months he will be fine.
What is general message you want to patients?
Heart valve disease, the thing is, people are very scared of operations, When you say surgery, means everybody is very scared. A lot of people, I know, who are even, I had a patient last month, I advised an operation 3 years ago. So they were scared, come back in end-stage heart failure, that day nothing can be done. Now, about 45, 46 years ago when I joined heart surgery, the risk of heart surgery was very high. Maybe 50%, 20% of the patients due to some problem used to have negative results, but in spite of good operations. Now, things have changed. Those days a patient surviving after an operation was a very big news. Today, a patient dying in a heart operation is a big news. That much technology has developed and experience of the surgeons all over India. See what is available anywhere in the world is available in this hospital. We have all the facilities, whatever related to the heart, anything we can do. We have the technology, the manpower and infrastructure, and we have the experience to do it. So it is very difficult to convince the people. They think, what happens also, social media, YouTube and all, people will spread wrong information. nobody will tell something right. Everybody is a doctor today. You understand? When olden days, if I suggest a treatment, patient will listen to me. Today, patient suggests a treatment to me. Doctor, I want this. So I have to listen to the patient. That is here where I am treating. First I asked, what do you want to tell me? First I said, these are the things. Then I said, sir, can we do this way, that way? So many things they will ask. And usually they come with a cell phone, with the iPhone over the questions. So I find more strenuous and painstaking explaining the patient and the relatives about the operation, because doing the operation is my job. Operation, there is nobody to disturb me when I am there. I do the operation, I have no stress at all. You understand, that is my job. But the explaining is the most difficult. I don't mind talking, but the person who asks the questions to me, they may not be knowing anything about the heart. Still they ask questions. If I answer the question scientifically, they will not understand a word of what I am talking. Because even after spending 55 years studying medicine, I am still learning every day. That is our medicine. We have not touched the tip of the iceberg still.